Have you been feeling really down lately? Do you sometimes wonder, what's the use? Well, you're not alone. Many people feel helpless trying to understand or deal with this mentality. That's why we are so blessed to have Dr. Jenkins, a licensed psychologist, and Dr. Upchurch, a licensed professional counselor and licensed chemical dependency counselor. They are both professors at Liberty University whose experience with such matters may help you understand what depression is and how to deal with it. So to get started, the first question we should ask is, how can we know if someone is depressed?
First of all, we need to distinguish between being depressed, having to do with mood, and having depression, which involves affect. Think of it as the difference between weather, which is temporary and dynamic, and climate, which is long-term and stable. Being depressed, a mood, may be related to many factors like not having a sense of purpose and meaning in your life. That's why it's so important to consider what you believe about God, about people, and about nature. In other words, how you see the world can affect your mood and how you live your life. For example, if you believe that God is fair and loving, even when life is tough, then perhaps you can better handle the painful emotions of anger, sadness, and depression.
Dr. Jenkins has raised a valid point. You should begin by finding truth in your spiritual life. But some specialists say that depression may be spawned by a series of losses, like losing your job, your good health, or maybe a best friend or loved one.
Some of these life factors, like loss of hope, for example, may result in a type of depression that can often be changed by first identifying how you view the world and how that worldview affects your mood. Often, changing how you act and react according to appropriate core beliefs can help diminish and even ward off depression.
We looked at the question, am I depressed? Now let's consider the question, do I have depression? There is a very important distinction between these two questions.
The comparison between weather and climate is a good one, because being depressed can be thought of as a temporary dynamic state of emotion. This type of emotional state is really related to sadness, associated with a life event and one's perception of that life event. Treating this type of emotional state is about helping someone change their focus and allowing time to heal any sense of loss. Having depression, however, is much more complex. It is characterized by a number of different symptoms, including sadness, that don't easily respond to change in how we think.
What happens when someone has horrible thoughts? Not just for a short period of time, but for a long duration.
Frequently, there may be chronic thoughts of loss and or death. There are often indicators that the body, particularly the brain, has become affected. Two indicators of this are persistent disturbance in sleep and appetite. In both instances, depression may cause abnormal sleep and eating habits. There is often a lack of energy and concentration, with excessive feelings of worthlessness and guilt. There can also be a number of vague physical complaints such as generalized muscle aches.
You see, generally, if several of these types of symptoms have persisted steadily for more than a couple of weeks, they may be indications that you have depression that needs professional intervention. If this describes you, then consult with your physician. There could be any number of medical irregularities contributing to the depression that need to be evaluated. Some of these conditions could include hormonal and cardiovascular irregularities.
Ruling out different factors, it may be necessary that the brain needs some medical attention through the use of antidepressant medication. Again, this is a decision that needs to be made in the consultation with your family, pastor, and medical professional. If you have depression, it is important to become involved in a counseling relationship with someone who specializes in the treatment of clinical depression. The evidence is overwhelming that effective counseling is very helpful for those who have depression, as long as that counseling focus isn't in on a structured way on beliefs, behaviors, and relationships that counter the downward pull of depression and support a life of joy and peace.
As a clinical psychologist, I've worked with many individuals who have been depressed and with those who have had depression. Although the journey can be long and difficult, it's possible to reduce or eliminate depression and to become more resilient to its effects. Because of how important the joy of the Lord had become in their struggle with depression, I've even had those with clinical depression become thankful for it. One particular comment from one of my clients has stuck with me for years. If it weren't for my struggle with depression, I wouldn't have found what true joy is.
If you are depressed or struggle with depression, I hope this video has been helpful by providing information, but more importantly, by restoring some sense of hope and direction in the midst of what may be dark days and dark seasons. Here are a couple of ideas to get you started on the right track. Stay away from bad foods. Foods such as white breads, refined sugars, and caffeine can be the cause of anxiety. Eating healthier and daily cardio exercising can really aid in your healing process. Another important tip, if not the most important, is sleeping. Lack of sleep can cause severe emotional instability and can be a major catalyst of depression. Through all of this, there is only one person in whom you can find complete healing. The hope and joy that you can cling on to is found in Christ. Once you take hold of this truth, you will be able to grasp the reality of why you are here, which is to love the Lord with all of your heart, soul, and strength, and love your neighbor as yourself.